It's tough out there. Our members are really quite angry.
As COVID-19 cases continue to spike and the healthcare sector continuing to see staffing shortages, it's not just staffing the hospitals that is a cause for concern, but it's the paramedics that bring the patients there in the first place. The Manitoba Association of Healthcare Professionals, the union that represents over 800 rural paramedics, received a copy of the October 2021 Medical Transportation Coordination Center ground report. This internal report points to a staggering combined total of over 17,000 hours where ambulances were out of service and unavailable to assist Manitobans in an emergency. President of the MAHCP says this is worrisome.
I mean, these statistics are back from October. And the crisis that we're seeing is continuing to get exponentially worse, especially with Omicron upon us and then the rise in case numbers.
The statistics provided from the report has now reached a 5-year high with no signs of slowing down due to the increased demand for ambulances and ongoing staffing shortages. Moreau says rural paramedics are at their breaking point.
They're feeling quite hopeless and in a lot of cases quite angry at this point.
Moreau says nothing will change until the crisis is acknowledged and paramedics are hired for full-time positions. City News spoke to a rural Manitoba paramedic who has asked to remain anonymous due to fears of repercussions. They tell City News the situation is terrible, citing the worst they've ever seen it. They say ambulance trucks never used to go out of service, but now each region is seeing at least 7 or more trucks breaking down, adding, of course, the lack of staff and crazy overtime shifts. The paramedic also mentioned the lack of response from Shared Health has had a big impact on paramedics, making them feel alone and is causing, quote, very low morale. Moreau says MAHCP members sounded the alarm this past summer in a meeting with Health Minister Audrey Gordon, but up until this point, there's been no official response to or acknowledgement regarding this crisis. We reached out to Minister Gordon but didn't hear back. We did, however, get a response from Shared Health. A statement reads in part, staffing of emergency response services has long been a challenge in some rural parts of the province, with efforts underway to recruit staff to provide 24/7 paramedic coverage in order to reduce Manitoba's reliance on overtime or on-call staffing.
They're willfully ignoring our demands for them to address this issue. As I said, we sat with the minister, we explained it in great detail. We offered solutions that we needed to start on, months ago, never mind months from now. It had to happen months ago. And again, we're seeing no action, no response from that meeting. And that's getting really hard for our paramedics to take.
In Winnipeg, Alex Karpa, City News.